I'm focusing today's show on a really sad but unnoticed fallout of the pandemic, in a sense, how children are not just dealing with the disease of COVID-19, but also with the death of one, or sometimes tragically, even both their parents. I'm bringing in Anurag Kundu. He's the chairperson of the Delhi Commission for Protection of Child Rights. It's a statutory body of the Delhi government that looks at all matters related to child rights. Anurag, thank you very much for speaking to us here on Newsworthy. I do believe the organization has intervened in a couple of matters in this case. If you can talk a little bit about some of them, whatever you can put out in the public domain.
Yeah. Anubha, we started with a couple of matters actually 4-5 days ago, I think, and in the last 4 or 5 days we have dealt with about 30 odd matters now. Not every matter similar or necessarily relating to the loss of a loved one, but equally severe or traumatizing. It started with a random message floating on Twitter in which these two children who had lost both their parents were at home and trying to arrange for the cremation of the parents. And I'm wondering if a 15-year-old child's job is that, and how will a child, or what must be the experiences of a child in those very moments, and how much support and what kind of support does a child require. So that's how it began, and now we're dealing about 30 odd cases already.
And I'm presuming you think that many of them are obviously sort of going under the radar or slipping from your notice.
In fact, I would say most are slipping away from our notice, which is where we have ramped up the outreach of a helpline so that we can at least try and reach out to those families and help undo or mitigate some of the risks that they are already at by virtue of the loss of the loved one.
What can an average citizen do if they find a case like this in their neighborhood or in their immediate family or even extended family? What should an average citizen do if they come to know about something like this?
I think the first and the foremost, ring us up. Our number is there. It's displayed on the screen. Call us up. Let us know the specifics of the situation, and let us know that there is a child who is at risk and who's in such a situation. Then that's the first thing. The second thing is, while sometimes the help takes time to arrive, can at least the essential basic services be ensured for the child? And more than the essential services, which of course matter, it's sometimes just a pat on the shoulder, just to sit with the child and just to say that you're not alone and that we are there for you, sometimes can go a long way. I think those are the few things that every citizen can do and must do. So I would strongly encourage every viewer of the show to report to us every time they see a child in distress and let us know, and we'll try our best to make sure the help reaches to that child within 24 hours.
As you've been talking and as we discussed, we have put out the Delhi helpline number that's flashing on the screens. But Anurag, a lot of people do know about Childline as well at 1098. If people were to call on this particular number, and let's say it's not just about Delhi or it's about another city, what is likely to happen?
You mean our helpline number from another state?
If they were to call 1098.
It's perfectly good. Childline has a well-established network across, I think, 20 odd states. And Childline has proven effective over the last many, many years for every child. I think our helpline had started for a much multi-dimensional functions for children. For example, they wanted to seek information about how is a disability certificate to be done, what's the deadline for admission under EWS category. It was supposed to be launched in the month of April anyway. So, and it couldn't be launched, and that's when we decided that this is the need of the hour, and we said this is what we can cater to. So either the helpline is actually equally good, honestly, and even at the back end, we and the DCPC and the Childline have remarkable coordination with each other.
Anurag, just for sort of my understanding, what typically happens when a call of this nature comes to either your helpline or 1098? What is sort of the things that set into motion, especially for a case during the pandemic when, let's say, a child may have lost a parent, another one may be at the hospital, or any of the other cases that you have seen?
I think first and the foremost thing that is done is to collect as much information as we can that allows us to first understand the situation and then plan our intervention. For example, if in the case that I was earlier referring to, the address was important, the specific situation was important, how far are the relatives are important, how soon can they arrive was important, who's in the neighborhood was important, phone number of the neighbor can be arranged was immediately important, and that helps us plan our intervention. For example, if we know that the child is alone, can we at least, if we know the specific address, we can activate our NGO network, our RWS network, the child welfare committees, and our own staff sometimes, who can reach that specific address and talk to the neighbor and say, while we plan some longer term strategy, can you at least feed the child 3 times, 4 times a day, and just have a 5-minute conversation every now and then, while we plan something a little longer term for the child. So I think a lot depends on, one, the situation that the child is in, and how much information are we able to collect in that very moment. But things happen sometimes so fast that the information is evolving sometimes as you are intervening. There's a lot of course correction while you're intervening.
What a tragic fallout of this pandemic. Anurag, in normal circumstances, if a tragedy was to befall any family and children were impacted, you'd have relatives sort of gather, take them into care and look after them, etc. But such is sort of the helplessness of this pandemic that sometimes in this situation, I'm presuming even relatives may either not have the means, may be far away, or may be impacted by the pandemic, by COVID-19 itself. What is happening in circumstances like that, and have you found cases of this nature?
Yes, see, the advantage that our society has is that we are a very close knit network, or a family or a society. So there are a lot of family members in the extended parts who often come forward to help the children in those specific needs. So that's one thing. However, in one particular situation, nobody was coming forward. I mean, relatives were ready to sponsor the food and the basic services, but it takes a lot more than that to raise a child, to comfort a child. And in those situations, there is no option left but to put the child in institutional care as per the process laid out under the JJ Act. Now, institutional care is important, but may not be the first choice, since none can replace the comfort, affection, and the warmth of a family. So we try and find out ways in which relatives can come forward.
Okay, so I think there isn't sort of much to probe as far as this is concerned, but I think it was an issue of great importance and awareness to at least bring to the larger public at large. So just as a last thought, anything else? A lot of us are relatively healthy. I've come out from the disease, but still relatively healthy. There are lots of other people who could take care, but you're saying apart from just informing about a case like this nature, we can't do anything, right?
No, informing is the first step. Of course, we can. See, these children are not from some other planet. These children live in your and my neighborhood. And if we all of us just start taking care of the children in our neighborhood, it will go a long way. And it can literally start by asking, just visiting the child, giving a phone call maybe once a day or twice a day as to how you're doing. What happens, or what experiences does the child have immediately in the next few days after a trauma can determine what kind of person that child grows up to be. So, I mean, there's a lot that every citizen can do. These children are essentially our neighbors.
Have you had cases where, let's say, one parent has passed away and the other is seriously ill or in the hospital? And
Yes.
At what stage have you found the children then? How many days later, etc., have you found the children?
Yeah, in fact, one of the cases that we had come across yesterday, wherein the mother was sick and the father was in hospital. And today we learned that the father has passed away. So one of the things that we are trying to do in such a tragic situation is try and leverage the existing institutions that already exist. For example, in this particular instance, the mother is illiterate, and God forbid, what will happen to the family here on? Because the only bread earner, the father, is no more. So we are trying to enroll her in the Delhi government pensions widow pension scheme, which will allow her a grant of 20,000 rupees one time, and then a monthly 2,500 rupees every year, every month thereafter, in order to ensure some level of sustenance for the family.
How old were the children?
12,
The child was 12.
12.
And possibly at home
Right
while
now,
the mother was in the
yes,
hospital.
right now.
Right. Fair enough. Anurag, thank you very much. I'm just, as a parting sort of short, putting the Delhi helpline number again on the screen. As Anurag said, the more information you have, succinct details, specific details, and if you're just looking out for the child, that would be good enough. You can also call the Childline number, that's 1098. It's a Childline service that works across the country, across geographies, and both the Delhi helpline and Childline are very well synergized and interconnected. Anurag, thank you very much for joining us here on Newsworthy.
Thank you, Anubha. Thank you.